So the second batch of the Johnson & Johnson vaccines have arrived in the Western Cape, and that was on Monday. Over 13,000 healthcare workers in the province have since been inoculated. The first vaccination outside the Cape Metro was also administered to healthcare workers in the rural outskirts. Meanwhile, in Limpopo, the Netcare Pholosho Hospital in Polokwane is also carrying out its second vaccination drive. For perspective on how this is all unfolding, let's bring in our Athi Mthongana at the Melomed Hospital in Cape Town. Pelane Phakgadi is live to us at that Netcare Hospital in Limpopo. Athi, let's begin with you. A lot of anticipation about how this will happen. Get us a sense of what you're seeing.
A very good morning to Ayanda. Well, as you may know, the first batch of the Johnson & Johnson Sisonke trial arrived in the Western Cape on Monday, and already Ayanda, you might have seen that this province was actually one of the first provinces in the country to actually begin the inoculation program, which is a partnership really with the national department as well as all the provincial health departments across the country. And so since the 17th of February, Ayanda, we've had over 13,000 health workers in the Western Cape getting inoculated. Melomed behind me has recently been opened as a private healthcare facility. It's an existing private hospital, but of course now the MEC for Health, during the course of this past week, opening up Melomed as another vaccination center for the Western Cape. They have several vaccination centers, about 8 of them in total, ones that would cater for the public healthcare sector and some, of course, for the private sector. And for the second batch, Ayanda, the Western Cape Department of Health has come out to say that they'll be allocating 64% of the vaccines to the public healthcare sector and the rest, which is 34%, to the private healthcare facilities. That's where, you know, you have your specialists who have been queuing in long lines at all these vaccination centers waiting to get that single jab of the Johnson & Johnson vaccine. And I can tell you, Ayanda, that the Western Cape government has already come out to say that they're preparing for a third wave.
That's the situation as it stands in the Western Cape. Let's glance at the situation in Limpopo. Pelane, another institution now being added to sites that are accredited to now finally administer these jabs. This is going to be a boost, hopefully, in that province's fight against COVID-19.
Well, definitely, and we have to just, pick it up from where Athi had left and talked about that particular third wave. The MEC here in the province has also talked about how they are also still preparing and not letting their guard down as far as the third wave is concerned of the pandemic. And their aim right now is to inoculate as many healthcare officials as possible, so that should there be that third wave, they'll be in a position to say that healthcare workers feel protected, and they will also have a mindset to say that they will be better protected to work the shifts that are mandated to. And now, just joining me now to give us an indication, of course, Ayanda, about his role during the pandemic in itself is an infection control coordinator here in the Pholosho Hospital. That's Kevin Ngumalo. Thank you for joining us here in Newsroom. Long lines we see here, but of course, this is just to come through and get that vaccination. And you were here at the peak of the COVID-19, controlling the diseases here in this particular hospital. How difficult was it to work during the pandemic?
Okay, first of all, good morning to the viewers. As infection control, my job was very difficult because we had to ensure that everyone that gets to the facility gets screened. We had to make sure that everyone is safe, including patients. So as infection control, you are actually in the front line to ensure that everyone is safe. So it was very difficult, to be honest with you.
Definitely. And let's ask Luyanda to show you, Ayanda, just on the side, the long queues that we are here experiencing. We're expecting 384 people to be inoculated here today, but the queues seem to be a little bit surpassing that. But talk to me currently about your role in ensuring that the vaccination process also goes well as a coordinator for the infectious diseases here.
Okay. As you can see behind me, you can see a queue there. So my role is to ensure that everyone that is in the queue gets screened and they can gain entry if everything is fine. And then from there, we need to make sure that everyone that is here is also vaccinated as well. Like you've alluded that we've got 384 doses. So we need to ensure, but we are very much excited that our healthcare worker can be safe from the pandemic. So we are very excited.
Definitely. Kevin Ngumalo there is an infection control coordinator here, infectious disease control coordinator here at the Netcare Pholosho Hospital. You've seen Ayanda long queues here. A number of health officials have come out in their numbers to get inoculated. And of course, that gives social media fright that said that people were afraid to come through and get their jab. But here we see that the health officials came in their numbers in this one facility, and we do understand that the same was happening in Toyando yesterday. So here in Limpopo, the vaccination program seems to be going well underway.
Right, a snapshot of the situation as it stands in both those provinces. Pelane Phakgadi live to us there from Limpopo at the Netcare Pholosho Hospital. That's in Polokwane, plus our Athi Mthongana in Cape Town.